So today we are inserting and removing a straight catheter. As always, knock on the patient's door, identify yourself, and identify the patient with 2 identifiers and perform hand hygiene and glove. You want to identify the need for a bladder scanning and how to perform it. You want to close the curtain or door to maintain privacy and raise the head of the bed to an appropriate working height, facing the patient, standing on the left side if you are right-handed or the right side if you are left-handed. Place a waterproof pad underneath the patient and assist the female patient into a dorsal-recumbent position and ask the patient to relax their thighs as they externally rotate the hips. For the male patient, assist into a supine position with legs slightly abducted. You want to drape your patient with a bath blanket or sheet and open the outer wrapping of the catheterization kit while maintaining sterile technique, applying sterile gloves using proper sterile technique, and while maintaining the sterility, you want to use the square drape and let it drape over your hands as you place it underneath the patient. Have the patient lift their hips and place the plastic shiny side underneath the patient's buttocks. Organize your remaining supplies on your sterile field and open the package of sterile antiseptic solution and open the lubricant. You want to cleanse the urethral meatus for a female with your non-dominant hand, fully exposing the urethral meatus by spreading the labia. Maintain the position throughout the entire insertion and use your cotton swabs to clean the perineal area, wiping front to back from clitoris towards anus, using a new cotton swab for each area, wiping along the far labial fold, near labial fold, and directly over the center of the urethral meatus last. For a male patient, if not circumcised, we need to retract the foreskin and grasp the penis at the shaft just below the glans, gently spreading the urethral meatus so the opening is more visible. Keep your non-dominant hand in this position throughout the procedure, and with your dominant hand, pick up the cotton swabs and move cotton swabs in a circular motion from urethral meatus down to the base of the glans, repeating at least 3 times with a new cotton swab for each circle. Pick up the catheter with the gloved dominant hand, holding the catheter 2 to 5 centimeters from catheter tip, and hold the end of the catheter loosely coiled in palm of dominant hand. For insertion of the catheter of a female patient, ask the patient to bear down gently as you slowly insert the catheter through the urethral meatus, advancing the catheter until urine flows out the catheter's end, about 2 to 3 inches. Release the labia and hold catheter securely with non-dominant hand. For a male patient, lift the penis to position perpendicular to the patient's body and apply light traction. Ask patient to bear down gently and slowly insert catheter through urethral meatus and advance catheter until your urine flows out. Hold catheter in place until the bladder is empty, and then gently remove the catheter while gently palpating over the patient's bladder. Remove equipment and place in proper disposable receptacle. Remove gloves appropriately, cover patient with a sheet, perform hand hygiene, and document.